As we're approaching hurricane season here in the southeast United States, but really more broadly applicable to everywhere where you experience flooding, earthquakes, tornadoes, the best advice I can give people moving forward is what I learned in Boy Scouts, which is be prepared. As far as what being prepared means, you want to really take stock of your household members, family, pets, know what you're going to need for at least 72 hours and have it ready to go at a moment's notice so you can load up and head out. Evacuation isn't always required, but when it's needed, there's very little time to prepare. So I think when people are putting together their ready bag or hurricane box, everybody knows to bring adequate clothing, food, water, but what a lot of people don't realize is that you need to bring all the medications that you take on a regular basis for yourself, for your family members, even your pets and pet food. Now, how much medication is going to be up to you and the particular type of disaster that you're preparing for, but I would always recommend at a minimum you're going to want 3 days of extra supplies, ideally a week. A lot of people also don't realize that when a disaster hits, many pharmacies will be able to provide emergency refills for a short period of time on certain medications without a doctor's authorization. So when a disaster is ongoing, it can be very tempting to admire Mother Nature outside, watch the rain and the lightning, but you have to be very careful to maintain safety at all times. Sheltering in place is always going to be your best option, and you have to resist the temptation to go explore before safety has really been all cleared. Many injuries can happen both during and following a natural disaster, and I see them every time a hurricane hits in the emergency department. Now, a lot of people are worried about being struck by lightning or a tornado taking the roof off of their house, but more often we see minor injuries that are very common and easily avoidable. Injuries that we'll see after a disaster or storm may include falling off a ladder, falling off a roof when it's wet and slippery, not wearing adequate shoes and stepping on something sharp, and in particular when we see clearing brush or fallen trees or debris after a storm. One of the most common consequences of a natural disaster, whether it's a hurricane or flood, is going to be the loss of electricity and other utilities in your household. Now, a lot of you are prepared and have a backup plan, which may include a portable generator or one even tied into your home circuit. Now, while these are extremely useful, you have to maintain certain precautions while using them. Most of these generators do have older incomplete combustion, which will result in carbon monoxide and other dangerous exhaust. These have to be operated outside only in well-ventilated areas because we do see incidents of carbon monoxide exposure during and after storms. The symptoms of carbon monoxide exposure can be very, very subtle and gradually progressive so that you don't really know there's a problem until it's too late. It is a odorless, colorless gas, so you're not going to notice it. Carbon monoxide exposure can result in nausea, headaches, fatigue, sleepiness, and in particular if you notice that more than one household member, even pets, are experiencing unusual symptoms, you need to get to a safe, well-ventilated space and call emergency services to come investigate. If I had to think back and give one piece of advice moving forward, coming into these summer months and dealing with the possibility of natural disasters, it's going to be use common sense, be safe, be prepared,